Hi everyone, my name is Amy. I am one of the medical estheticians and non-surgical providers here at the Bengtson Center, and we are so excited to welcome you to our Softwave webinar. We have a lot of different options here at the Bengtson Center to help address collagen and skin laxity. Softwave is a little bit different because it will help to stimulate not only collagen, but elasticity and hyaluronic acid. It is a non-invasive treatment that stimulates collagen to provide a subtle lift to the brows, submental, and neck, as well as improving fine lines and wrinkles. Compared to other treatments, it's also a little bit more comfortable. Results show faster, and it's designed to be a little bit more safer and more precise of a treatment. One of the benefits of Softwave is that it can be done year-round. With other treatments that we have to be careful about the sun and exposure, whereas Softwave can be done in the middle of the summer or in the winter. It provides really natural results that do not alter the way that the person naturally is. And it only requires, 1 to 2 treatments. When I'm consulting with a patient, we also talk about the fact that Softwave is addressing a structural response from the body. So pairing it with other treatments like microneedling, injections, or lasers to address more superficial concerns, pigment, discoloration, things of that sense are also a great option. So Softwave is FDA approved to provide a gentle lift to the brows, the submental, and the neck. We can also treat the laxity on the arms, as well as cellulite on the back of thighs and acne scars. So Softwave is great for everyone. It is safe for all skin types, ideally for patients in their 30s or older who present some mild to moderate laxity and fine lines. Softwave is a great treatment for those patients who might be considering a surgical route in the future or are not quite ready to pull the trigger on a surgical treatment. Bringing in Softwave to stimulate that collagen is a great option. Softwave is also a great treatment for patients who have had surgical procedures in the past, whether that's a blepharoplasty or facelift. Doing a Softwave, annually to maintain and protect your investment is a really wise choice. So at the Bengtson Center, we really strive for excellent patient satisfaction, and educating our patients is a big part of that. So during your Softwave consultation, we'll go over everything and make sure that your expectations can be managed by the treatment. If not, the beauty of this place is that we have, estheticians, injectors, and board-certified surgeons to help you reach those goals that you have. Depending on the amount of laxity and skin quality the patient presents, we recommend 1 to 2 treatments. After that, this is a really awesome procedure to do annually or every other year, just to kind of maintain that collagen. Most patients report seeing a change around the 12-week mark. However, we give the body at least 6 months to see your full results. So everybody responds to treatments a little bit differently. Softwave has built-in technologies to aid in comfort itself. However, we do supply other methods for the patient. Once we start the treatment and remove the numbing cream, we also have different options to kind of keep your mind off of what we're doing. We have hand massagers, breast implants to squeeze, as well as Pronox. Pronox is a great tool to use during this treatment. It is a 50-50 mix of nitrous oxide and oxygen, and that just helps the patient with the little anxiety and take their mind off of what is happening with the treatment. So one of the greatest things with Softwave is that there's absolutely zero downtime. You can jump right back into your normal life and activities as planned without worrying about recovery at all. So we book our Softwave treatments for a couple of hours depending on what areas we're treating. That takes into consideration taking photos, going over the procedure, and numbing. Once we get started, the treatment takes about an hour, again depending on what area of the body we're treating. Treating Dr. Bengtson with Softwave. We'll be treating his face and his neck. Our goal is to provide a nice gentle lift to the face and to stimulate more collagen, elasticity, and hyaluronic acid levels in the body. Starting at the forehead, we're going to be working on the brows to provide just a nice lift to the brow to take some pressure off of that hooding that we get. We treat the crows and under eye as well. We'll be spending a lot of time in the cheek area to kind of build up those cheekbones, and by doing that we take pressure off of the jowling lower face area. And then we'll be traveling down the neck to really give a nice lift, soften some fine lines, and keep the contour nice on that jawline. Thank you so much for attending our webinar. Stay tuned for a live Q&A next. Hi, everybody. Thanks for joining us. My name is Amy. I'm one of the estheticians and the non-surgical provider here at Bengtson Center. And this is Allie. We are here to answer some of your questions. We're so excited that you joined us this evening to learn more about Softwave. Feel free to drop any questions that you have in the Q&A box on the right side of the screen, and we will go ahead and start answering some of those questions.
All right, we will go with the first question here. Looks like, how long does the Softwave treatment session take, and what is the downtime? So typically when you come in, we will take some photos, just so we have really good before and after photos. And then you numb for about 30 minutes, and then we get into the treatment. So the treatment depends on what areas we're treating. Typically for the neck, it takes around like 45 minutes. And then when you include the face as well, it's around an hour and a half for the treatment itself. And then as far as downtime, really there is no downtime at all. You leave as like you came in. I mean, you might be a little red, but that typically goes away relatively fast.
All right. So the next question here is, if I had Sculptra, can I still do Softwave? Yeah, the answer is yes. You can pair Softwave with really any other type of injectable treatment. We just like to have you schedule it safely around your injection. So we typically have a rule of thumb of waiting at least 2 weeks. With Sculptra, I would probably wait a little bit longer because it's a progressive injectable. But we can absolutely pair Softwave with other injectables, including Sculptra.
Is there anything we should do to prepare for Softwave, such as stop retinols or any other skincare products? Yes, I would stop retinols 5 days before treatment. I mean, Is it going to be terrible if you don't? No, but it just might be a little bit more spicy. And then I will say too, if you are prone to cold sores, we would want you to be on a medication a couple days before, just to prevent cold sores from coming, because sometimes with the Softwave, it can cause a cold sore if you are prone to them.
All right, let's see. Does this work for front of thigh skin laxity? So as of right now, there is not clearance for the front of the thigh skin laxity. However, we are looking into phase 2 of this technology to hopefully provide treatment to other areas of the body.
See, how long after the first treatment should a second treatment be scheduled? So typically you will see your results in 3 months. So you're going to continue to build the collagen, and you'll see your results in 3 months. Some people need another treatment in 3 months, and some is good for a year. It all just really depends on the patient.
Next question is another great treatment incorporating multiple modalities. So if you had Morpheus 8 on your face and neck approximately 3 months ago, how long should you wait before you treat with Softwave? I would say, your 3 months is a good number. You'd be ready to treat anytime after that, giving yourself that proper time to heal from the Morpheus itself. Can you treat just your neck? So yes, the answer is yes. We can break up treatment areas. So we have different packages for different areas of the body, but treating just the neck is absolutely an option. And we can always talk about how we separate that more in your consultation.
And then we're getting a question about their specials. So if you purchase 1 treatment, you get 15% off. And if you purchase 2 treatments, you get 25% off.
Good question here. Does this work for everybody? What if I only get negligible improvement? So that's a good question. So how I kind of present this with patients is it's a non-invasive or a non-surgical treatment. So with any non-surgical treatment, it's really up to your body and how it heals and deals with the technology. So some people may respond a little bit better than others. A lot of times it will depend on how much laxity and skin quality, where the skin quality is at before we start the treatment, which again, we'll discuss during your consultation to make sure that this is the right treatment for you. That kind of leads me into the next question is, will you help me decide what treatment is best? So yeah, absolutely. When you come in for your consultation, what you'll do is you'll present your goals and concerns with us. And what we can do from there is then find the right path for you, whether that is Softwave or any other options that we may have to offer here at the Bengtson Center. We really thrive to give you a custom plan specifically for you and help you reach your goals there.
Let's see here. Sorry, we're just reading through these real quick. So someone had said on here, I read a lot about this. It seems everything that I've read says it's very painful. Is that true? I will say everyone handles it a little bit differently. It is a little bit spicy, I will say. So it will heat up for a good 5 seconds and then it'll go away. And then it'll get hot again and then it'll go away. So the pain is, like I said, it heats up, goes away, and then we do that along your whole entire face. So it does get a little spicy. Like I said, everyone is a little bit different. Some people handle it without a problem whatsoever. And some people, yeah, it's a little bit painful for them.
Yeah, absolutely. It's interesting to see how different patients respond differently. So what I'll piggyback off that by saying is patients typically say that their pain is around a 6 out of 10 on a scale. What's also nice about how we've designed Softwave is that we have included Pronox in the price of the treatment. And Pronox is just like a really soft laughing gas that kind of takes your mind off of what we're doing. So it's definitely helps with like the pain aid of it all. It's also something that you can drive yourself home on, which is great that you don't have to, arrange a driver to get you home afterwards. You don't have to pay for it. So if we start doing the treatment and you're like, oh, Amy, this really is uncomfortable, I'm not liking this, then we just roll in the Pronox and that really helps you get through that last part of the treatment.
So we got a question on here. Would the pain be similar to a laser treatment? So I will say laser treatments, they are a different kind of pain. So like for a BBL laser, it's more like a snappy, and the light can be very startling with the BBL. You don't get that with the Softwave. And then like with a Moxie, the pain is different with that too, because you are getting a lot of heat and your face feels like it's like on fire. This is different. The pain is there and then it goes away, and then it comes and it goes away. So it's a little bit different than laser treatments for pain wise.
The nice thing too with that is it's, it's not residual pain. So if you've ever had microneedling or lasers, you know that when you get in your car, your skin feels like it's on fire, like you've been at the beach all day. With Softwave, you don't have that. It's not a residual pain. So if you get through the treatment, you will be absolutely fine. There's, again, no downtime. And there's really no restrictions. As an esthetician, I just like to advise my patients to avoid using like a tretinoin or a retinol topically for a couple days after the treatment. But it's really nice and easy to schedule into your routine because you do not have to consider that downtime with it. I have a question here about contraindications. With Softwave, the biggest contraindication is if you have any active implant, and any open wounds, cystic acne. And then we have like some considerations or things that we like to consider before going through a treatment. So we just like to consider the skin condition of the patient. Melasma is something that, again, as an esthetician, we like to take into consideration because this is a thermal heat type of technology. There is a risk that it could spark those melanocytes to cause more melanin and trigger the melasma within the skin. But I will also say on that same page is that Softwave is really cool on how it's incorporated a cooling aspect with the applicator having a cooling touch to help mediate that heat that acquires over the treatment. I've treated many patients so far that have melasma and have not had any flare-ups with that at all.
Is the consultation booked separately from the first treatment? Yes, we would want to have a consultation with you first just to make sure that this is the right treatment for you. And then we'll go over everything that you can expect from it and just go into detail about that. So yes, it would have to be booked separately just so we are for sure, know that the Softwave is the best treatment for you.
Next question. This is a good one. How old is too old? So Softwave is one of those treatments that is ideal for those who are like their 30s, 40s, 50s, who have very mild to moderate laxity. It can be used on patients who are, a little bit older. I will say that what I like to tell my patients is if you feel like surgery is not off the table, I would always explore that option with one of our fabulous surgeons here. Again, this is a non-invasive treatment, so it can't provide you with surgical results. So it's always just a consideration given the price and everything. Would surgery be a better option for you? And again, that's really something that we like to dive into more specifically on your one-on-one consultation.
Yeah, I was just going to piggyback off of that. Like we will definitely, if we think, the Softwave is not going to be the correct treatment for you, and we think that you might need a facelift rather than, spending your money on the Softwave, then we're going to steer you, in that direction. Just because we don't want you wasting your money on something that you're not going to be completely happy with if you're, wanting the facelift results.
Absolutely. Absolutely. I'm going to scroll down and see if we missed anything. Will you need a driver? The answer is no. Even if we were to use the Pronox, which is that laughing gas in the treatment, you can still drive yourself home after that. We're just scrolling through to see if we've missed any other questions here. Who is the ideal patient for this treatment, and what are the ideal concerns that you can treat? So the ideal patient is somebody with really mild to slightly moderate laxity. Again, in their 30s or 40s is ideal, where you still have a good amount of that collagen present. Softwave will help to address laxity and fine lines on the face and the neck. Is 60 too old? That's a very good question. It really depends patient to patient on how much laxity we're presenting. So I would recommend scheduling a consultation with one of us so that we can see you in person and kind of give you a better gauge as to if this is something that would be worth it for you.
We got a question on here. After a facelift, the forehead is still wrinkled and between the eyes. What would you suggest? So I'm gauging this right here. So like we can treat above the eyes right here to help you get a lift. But if you still have like wrinkles in between your eyes right here, I would, suggest laser or even Botox for that.
Absolutely. I like to recommend this procedure to any patient who's had a blepharoplasty or a facelift or neck lift after your surgery. After a couple of years of, your results of surgery, doing some sort of treatment like Softwave to kind of protect your investment and keep the collagen in the face nice and lifted is a great option. Again, especially if you've done like the blepharoplasty, just to keep that lift in the brows.
All right, we'll see if there's anything else that we missed here. Let's see. All right, looks like that is about it. As a reminder, you'll be receiving a text message, and please reply with the code word special to be contacted for a consultation. Thank you all.
Thank you.